Hi, this is Dr. Greg Relo with ExpressDentist. You may have heard that there's a link between oral and general health. What goes on in your mouth can affect the rest of your body. Now, there's a lot of interesting research on this, and some of it is just correlations or links between the two. And then there are others parts of the research that suggest that there's a very strong cause and effect potentially for different types of conditions. So let's just take a look at this and see what we can learn about this relationship between the two. So first of all, gum disease is a chronic inflammatory disease that too many people deal with, and it has been associated with a number of health conditions that you've heard about. And why is this? Well, it's because infections that are in your mouth, they will make their way into your bloodstream. See, there's over 30 square inches of tissue in your mouth, and if it becomes inflamed and raw in a sense and starts to bleed, then those bacteria that are causing the problem can enter the bloodstream and they travel through the body very, very quickly. Now, specifically, there are some pretty strong correlations between diabetes and gum disease because diabetes really weakens the immune system. It makes you more vulnerable to infection. So not only does that put your gums at increased risk for gum disease, but once that infection becomes prevalent in the mouth, then diabetic patients tend to have more difficulty controlling blood sugar levels. It's like a two-way street. So you have to be very careful with this one. Diabetes and gum disease are pretty strongly correlated. And then another interesting fact is that the risk of adverse pregnancy outcomes has been associated with poor oral health. You know, they've actually found oral pathogens or bad bacteria that have infected placentas in pregnant women. And so gum disease has been associated with low birth rates and preterm birth and other pregnancy complications. So this is a very real risk. And do you know that half of all American adults have some degrees of gum disease? And so this is something that's really putting people at risk as we understand this correlation and can have such an effect on their general health. Here's something else that's interesting. Gum disease and tooth loss increases the risk for Alzheimer's disease. Now, we don't know all the reasons why, but again, when those bacteria enter the body, they can make their way to the brain. And there's a pretty large study that's come out that looks at adults with signs of infections in the mouth, that they are more likely to develop Alzheimer's disease. I think this is a very serious thing. And along that line, you know, oral bacteria have been found in the brain, in heart vessels, in joints, and many other parts of your body. They've actually dissected these bacteria out. So that does tell us something that they're at least present in tissues that are having problems. What about this? That bacteria that cause gum disease have been linked to high blood pressure. In fact, people that have gum disease have an increased risk of high blood pressure by up to 3 times. And so this is, you know, we can only make a correlation here. We don't know the cause and effect. And number 7, you know, pain is one of the top oral health problems that young adults report. Now, you may not consider pain a disease, but it's not normal. It's not normal for up to 30% of young adults to have visited the dentist within the last year due to pain. It usually indicates that something's not right. And number 8, we know that poor nutrition can damage your teeth. If you have a poor diet, it just leaves you at risk for certain types of bacteria. Foods that are high in sugar and carbs and acids, they just weaken teeth. And of course, when you get those types of problems, it just can lead to infection, and that's not a good thing. Number 9, there's very interesting research between your oral health and your heart health and heart disease. And so the risk for cardiovascular disease actually increases with every tooth that you lose. And there's much more that we could dive into, and we may do that in another video. I think this last point, number 10, is important. It doesn't really have to be the case because we can detect oral disease, we can control oral disease, and by doing so, not only can we help you save your teeth and save a lot of time and money, but also help you with your general health and control your risk for many other diseases. So at Express Dentist, we have a trusted network of providers. We can help you find a dentist that you feel comfortable with, you can get in and see. So please feel free to reach out and we will help you get connected with a dentist in your area so you can protect not only your oral health, but your general health too.